523 million people around the world had some type of cardiovascular disease in 2020. Also that year, cardiovascular diseases were attributed to estimated 9.1 million deaths around the world. High levels of bad cholesterol or low-density lipoprotein, LDL cholesterol, insulin resistance, obesity are all known factors that can increase a person's cardiovascular disease risk. In this area, Stanford University did a very interesting trial using a pair of identical twins. Researchers found that following a vegan diet can help improve a person's cardiovascular health in as little as 8 weeks compared to those who follow an omnivore diet. So today's story is all about vegan diet and cardiovascular health. I am Amit Deshpande and you are with Star Health. In a few moments from now, I will present you a critical evaluation investigating vegan diets and cardiovascular health. So stay tuned and watch till the end. The story of clinical trial in identical twins was performed at Stanford University and published in JAMA Network Source. For this study, researchers recruited 22 pairs of identical twins, with one twin asked to follow a vegan diet and the other an omnivore diet. Now the question is, why study identical twins? Studying nutrition in humans is always complicated, by humans being so different in so many ways, different exercise habits, sleep patterns and stress levels. In a randomized clinical trial, which is the gold standard of human research, those different factors are assumed to be equally distributed between study groups due to the randomization. But there are always some factors that are not equally distributed. The idea of working with identical twins is very fascinating because when randomizing identical twins to two study arms, the genetics are perfectly matched, and likely many other factors are matched because these pairs were raised in the same families, lived in same neighborhoods, and many other similarities. In fact, it was quite entertaining how much these adult identical twins looked alike, dressed alike, and talked alike during the study. During the first 4 weeks of study, all participants received 21 delivered meals per week from a meal service that followed their specific diet. For the last 4 weeks, study participants were required to make their own meals. They also had an access to an on-call registered dietitian to answer questions and offer suggestions. At 3 points during the study, that is the beginning, halfway through, and at the completion of 2 months, researchers weighed the study participants and drew blood. At baseline, the average LDL cholesterol level for those following vegan diet was 110.7 mg per dl and 118.5 mg per dl for omnivore participants. Those levels dropped to 95.5 for vegans and 116.1 for omnivores by the end of the study. So a clear drop in LDL cholesterol was seen in vegan diet as compared to omnivore diet. Scientists also found that study participants following the vegan diet had about a 20% decrease in fasting insulin levels and lost an average of 4.2 pounds more than those following the omnivore diet. Researchers were a bit surprised to see the differences were as large as they were for the LDL cholesterol and insulin. The participants randomized to that diet actually increased vegetables and whole grains and decreased added sugars and refined grains compared to their pre-study diet. That also likely minimized the opportunity to observe such a big difference. This clinical trial observed statistically significant beneficial changes for the vegan group relative to their identical siblings on the omnivore diet. The major finding in this trial is that this study supports how quickly a switch to a more plant-based diet can lead to rapid improvements in cardiometabolic risk factors. Small diet changes can positively impact heart health, while not everyone may want to go vegan. Medical experts agree that even slight changes to a diet can positively impact cardiovascular health. According to the experts, the vegan diet is rich in a lot of foods considered heart healthy and is associated with decreased risk of heart disease such as fruits, vegetables, nuts, legumes and whole grains. All this data is scientifically backed up by clinical trials. Even if you don't follow a strict vegan diet, a lot of these studies have shown us that as long as we can increase our intake of those types of food, that we should be able to make substantial improvements in our heart health. A vegan dietary pattern may not be appropriate, desirable, feasible, or accessible to everyone, but focusing on adding more variety of plants is usually beneficial and applicable to the majority of individuals. Trying a new vegan recipe each month or learning a new cooking style or skill to enhance the flavors of plant proteins like beans and legumes can also bring a lot of change. All the small efforts can add up to a significant change. If you are not sure where to start to improve your cardiovascular health or what to tackle first, partnering with a registered dietitian nutritionist can be a great first step. So the take home message is that vegan diets can very well improve your heart health, and that brings us to the end of today's story about cardiovascular disease and vegan diet. For more medical updates, please do subscribe the channel. Thanks for watching and signing off for now. Have a great day ahead. Thank you.